Morning, Beth. Hi, Joey. Debbie. It's cloudy today. Cloudy but warm. I'll take it.
Thanks for watching.
Uh, Picked the wrong one. Okay. Good morning, everyone. Yeah, it's stranger. I feel like a different person. It's been a long couple of weeks, and I just started answering emails last night, and there are a lot of them, and it's going to take me a long time to get through them. So I appreciate your patience. Probably a lot of them. Either your question has already been answered or the problem already worked itself out. I apologize for not being available, but things are what they are, and I was where I needed to be. So mom is feeling much better, and we are very grateful and thankful for all of you who supported us during that time. So, one of the questions I had in an email was about the difference in senior diets for dogs. And the person sent me a very long email, but the longest part of it was from a friend's veterinarian who just went off on a tirade about AFCO formulation, and it needed to be AFCO formulated for a senior dog, and you can't just feed any food to a senior dog, blah, 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 blah. And it was frankly bordering on ridiculous. I thought, well, you know what? Let me talk to you about senior food versus adult food. And if you're making your own food for your pets, or buying a formulation, whether it's freeze dried, raw, whatever, that you really like and that your pet really likes, do you need to make a change? Is it imperative once your dog hits a certain age? If you have a large breed dog and they turn 7 years old, or you have a small breed dog and they turn 11 years old, do you have to make this huge shift in how you're feeding them? And the overall answer is no, you don't. If your pet is doing well, there is no need to make changes. Charlie, Scout, Freckles, Charlie lived to 19, Scout lived to 18, and I did not put them on senior diets. Their lab work was great right up until the very end. They did not have kidney problems, they did not have liver problems. They got a little pickier about what they would eat in their senior years. Shayna recently has become much pickier. She has one thing that she does best on. It's funny, it's the same thing that Charlie did the best on, and that's the all provide turkey. But what we have discovered now with Shayna, she can eat the chicken, but she does best on the turkey. She is spleen chi deficient. She doesn't digest as well. She is prone to developing soft stools. And she's really been backing off her food, not wanting to eat. And she doesn't like to eat first thing in the morning. She likes to wait a little bit longer. And then she'll finally eat it around lunchtime. And then dinner time, if we wake her up from a nap, she's been sleeping deeply. We got to take her outside, get her moving, and get things rolling before we can get her to eat. So I said, I think that she is getting turned off with the raw because she's spleen chi deficient in her old age, which happens to a lot of us. Happened to my mother and happens to a lot of our pets as well. And their digestive system doesn't work quite as well. So we started cooking the All Provide. The All Provide is a raw food that has the bone ground finely enough that you can cook it. So we started cooking it, and she's chowing down. It's just her body telling her, look, I need it just a little bit less yin, so a little bit drier, a little bit warmer. So we need to make her food a little bit more yang for her right now, which is funny because she was always a very hot dog, and she's changing in her senior years. So from a Chinese medicine perspective, we might find that these dogs are too yin or too yang because they've had a whole lifetime of having things not completely perfectly balanced with their yin and yang. And once you figure out which direction they're heading, then you can change your proteins, change your food formulation, whether you go to a baked formulation or a slow cooker. Hers were just sauteing it on top of the stove for a minute and a half, and that is perfectly fine with her. She absolutely loves it. So what do the big pet food companies change with senior foods to make them more senior appropriate? Well, we do find that seniors, just like senior people, tend to be lower in vitamin D, lower in zinc in their bodies. And so maybe we're going to supplement a little bit more vitamin D in that diet. Maybe we're going to supplement a little more zinc in that diet to support them. We want certainly to have things that are good for joint support. Well, if you're feeding a raw diet that's got bone and cartilage in there, they're going to be getting natural sources of glucosamine and chondroitin. For our guys, they're eating a raw diet. Well, now Shayna's is gently cooked, but they also get our deer antler, velvet, and green lip mussel, the wellness and senior formulas, to help support their joints. So we know we need more joint support. We need more arthritis support. They take the CoQ10, which is not generally added to pet food, but it's something, again, our body doesn't make as well as we age. A lot of the senior foods will have more fish oil in them, omega 3s, because they need that for cognitive support, they need that for joint support, they need that for heart support. Now, the problem with something like a dry kibble that is higher in those fish oils and omega 3s, they have a lot higher chance of also becoming rancid with storage and exposure to heat and light. So, maybe not the best way to get those omegas into the dogs. And frankly, if you're paying a lot more money for a senior food that has added glucosamine and chondroitin and added fish oils, it's probably not in a high enough amount to really make a difference. You'd be better off just using a supplement that contained natural fish oils, natural glucosamine, chondroitin, hyaluronic acid, because you're going to get a much better effect. So, and it's interesting, I did a quick little Google search on, what the pet food companies recommend. And what they recommend is increasing carbohydrates, decreasing protein, and decreasing fat. Well, a lot of these seniors have a hard time maintaining weight. They're starting to lose muscle mass, and if we restrict that protein, it's hard for them to maintain that muscle mass, especially if they're losing protein in their urine or their stool. So I don't make those changes. I don't cut back on the protein, and you know that I don't use a lot of starchy carbohydrates for our dogs because they promote inflammation. So for me, I use a very high quality adult food. They eat primal, they eat vital essentials, they eat all provide for the most part. They eat homemade meals, whether they're raw or cooked. And they do just fine with that. So you don't need to make these big changes. Our guys do get a vitamin D supplement. They were all tested for their vitamin D levels, so I know what their supplementation needs to be. They get, other supplements in their food that are going to support them more so than switching to a labeled senior food. So I don't make huge changes, and I in practice did not tell my people that had dogs that were or cats that were becoming seniors that they needed to make big changes in their diet if they were already on a very high quality human grade meat based diet. And if they were already on that, there's no need to make these huge changes. You might want to test vitamin D levels. You might want to see where they are, see if they're low, and then use supplementation as needed for different issues that they might be having. So, this long diatribe that this veterinarian wrote out about, AFCO formulation and senior this, that, and the other thing, kind of bordered on the ridiculous. And it was a very long lecture that was given to the client by email. And so I thought it was kind of inappropriate. But for those of you who are still thinking about making your own meals, the Homemade Food 101 is the course is still available. It's pinned on the top of the Judy Morgan DVM Facebook page, and there is still a 25% discount on that. Not sure how long that's going to last, but the code is 2021 launch. And don't forget that this coming Friday, Saturday, and Sunday is our summit. The summit is different this time. It is not going to be streamed live on Facebook or posted on the Facebook page. You need to sign up for it. And when you sign up, you will be able to see those as they're going live. And you will also get the videos to download in your email box. So make sure you sign up. And that's, they're both posted on the website. Okay. Everybody have a wonderful day. We're doing things like picking out countertops and tile and trying to catch up on email and take care of mama. Vitamin supplements for the 101 diets, they're explained in the course, and we give you multiple options. So if you're making a homemade diet, unless you're making a complete diet that has all the vitamins and minerals coming from the food, then you are going to need to supplement with something like the RX Essentials and Minerals, or there's other options. The Carnivore Flora4 is a great supplement as well, and that one gets you probiotics, digestive enzymes, vitamins and minerals all in one supplement. So that one's really good. Yeah, Mama's doing so much better. She's just really weak. It'll take a long time to catch up.
Thanks for watching. And remember, you can find more information on Dr. Morgan's website at www.drjudymorgan.com.